As we breathe, we've said that there were 3 actions that I need to be able to move: the diaphragm, the rib cage, and the breastbone. But in order to do that, of course, I need to get the air in. So the lungs themselves are responsible for drawing the oxygen out of the air and pushing it into the bloodstream. But we have other parts of the respiratory system which are involved in getting the air into the lungs. So those would be the air tubes. So we've got, as we take a breath, the air needs to come through the nose and in through the mouth, and we have sinuses there which are like sort of hollow areas or caves, if you like, which protect us. The air then comes down through the windpipe and comes into the lungs. So what we're doing now is working on alternate nostril breathing. So we're going to close one nostril as we breathe. And the reason that we do that is throughout the day, typically, we don't use a breath through both nostrils. So we tend to find that one nostril is favoured, in the same way as you might favour one side of the body when you're walking, or one hand when you're writing, for example. So if you've ever had a cold or a flu, you'll often notice that one nostril gets blocked up. And that's because you get mucus forming in the sinus on one side. So the aim of this alternate nostril breathing is to try and clear the sinuses and get the breath to flow evenly throughout the whole of the respiratory area. So I'm going to close one nostril, breathe through the other, and then reverse that. And I can do that just by pinching. Traditionally in yoga, what we do is we use 2 fingers, the 4th and 5th finger, and the thumb, because those are softer, forming pads. And then we move the other 2 fingers out of the way. So I'm putting 2 fingers on one side of the nose, my thumb on the other side of the nose, and I'm moving my fingers out of the way. So I take 2 fingers on one nostril, the thumb on the other nostril, and I bend the other fingers out of the way. Looking down at the floor, breathe in, close the nostril, breathe out, open the other nostril. Breathe in, close the nostril, breathe out. So, in this action, I'm breathing in through one nostril, allowing the air to flow through the sinuses, and breathing out through the other nostril. So in this case, what I'm going to do is use my 2 fingers to close the left nostril, which means I'm breathing in through the right, retain the breath for a while, close the other nostril, leaving the left open, and then breathing out through that one. So it's as though I'm breathing in one side, the air goes across the top, and I breathe out the other side. So 2 fingers on one side, 2 fingers bent, thumb on the other, looking down towards the mat. So alternate nostril breathing. Open one nostril, breathe in, close that nostril, open the opposite nostril, breathe out. Keep that nostril open, breathe in, and swap round. So that action will clear the sinuses. And once we've done that for a while, we can then focus on breathing in and out through the same nostril. So I'm closing the left. Right is open, breathe in.
breathe out. Close the right, left is open, breathe in, breathe out, reverse.
Remember that when we're breathing, there are three parts to the breath. There's the inhalation, retention, and exhalation. So we're making sure that we're using all three. So I'm breathing in slowly, retaining the breath, and then breathing out slowly. So one of the mistakes that people make is sometimes they don't retain the air for long enough. So they breathing in and out, but then we're losing that vital part of the breath, which is the retention, keeping the air in the lungs so that we can transfer the oxygen into the bloodstream and use that. So that's our alternate nostril breath.